everyone. Welcome to the Go Live. We're going to be having a chat today about COVID and diverse populations. Please do say hello in the comments. Let us know what your name is, where you're from, and ask any questions for our guests. My name is Miriam, and I'll be moderating our conversation today. I'm an artist based in Miami, Florida. And my passions are art, community, technology, and sustainability. There's been a lot of noise in our community about COVID-19, the vaccine, and with it being the 1-year anniversary of the first reported case here in Florida, I brought together our special guests to discuss and share knowledge on this topic. Of course, just remember to ask your questions for them using the comments feature. We'll keep today's event just short and sweet. Quick 15-minute conversation followed by some 15-minute Q&A. So again, don't forget to ask your questions in the comments below. Let's get started with a brief introductions. I'm happy and really thrilled to have Ulysses Burley here. He is working for UBtheCURE. He's the founder of UBtheCURE and really operating at the intersection of health and human rights. He's interested in things in our society that make us sick: poverty, discrimination, our government, gender-based violence. I've been able to chat with him about all of these things that result in our poor health outcomes. And he's been focused on, of course, COVID-19, and prior to that, even HIV/AIDS. So we're excited to welcome him. And then we are also joined by Derek. He is the founder and chief executive officer at CoreMed, in multi-patented inventor and entrepreneur, doing some really innovative things with his on-demand delivery of healthcare services to people. So you no longer have to leave your home to get the services that you need. And even before COVID-19, he was off building this brand, but of course we've seen an acceleration in his success with COVID-19. So with that, really excited to jump right into our conversation. Derek, I would love to start with you. What has it been like since you were going along, you're building this CoreMed brand, and then all of a sudden COVID-19? How did you pivot? Like, what exactly did you go through?
Well, we had already knew there was relevancy in what we were doing, right? And when COVID hit, it just validated what we were already building, and people just really saw the value, and we saw our volumes really jump out of the window as far as what we're doing on a daily basis. But with COVID-19, we saw an opportunity to pivot and actually bring the vaccines to people's homes. So we actually have a section on our website where people are signing up in the state of Florida and the state of Texas right now.
Excellent. That's very exciting. It's nice to see that some of the states have really welcomed you in. Ulysses, I know that you have been heavily involved in this work. What is some key points that you've been seeing in the past year?
Yeah, absolutely. First of all, thank you for having me. Pleasure to be alongside Derek to have this important conversation. As Derek mentioned, we all had to pivot, if you will, shift. I'm trained in allergy and immunology, but most of my work has been around HIV and AIDS. And many of the people at the forefront of the science and the medicine addressing COVID-19 are HIV and AIDS practitioners, people who have expertise in infectious disease. And so, come last March, I had to pivot and shift, much like everyone else in my field, and really began to read all of the literature available to me as it relates to COVID-19, and began to do the same kinds of information and education sharing that I've been doing for HIV and AIDS for COVID-19, particularly in vulnerable populations that are overwhelmingly Black, Latinx, and Native and Indigenous. And so for the better part of 2020, I was engaged in education events, mostly virtual, around COVID-19, the disease. And then last summer, in response to the pandemic, the National Institutes of Allergy and Infectious Disease at the National Institutes of Health founded the COVID-19 Prevention Network, which is the collection of many agencies who have been doing biomedical research and innovation for decades to answer the current need of the pandemic. I joined the COVID-19 Prevention Network last August as a part of their community engagement strategy to, on a broader level, engage Black and Brown populations around COVID-19 science, but more importantly, COVID-19 vaccine science and information to prepare the country for what we knew was going to come in the availability of vaccine candidates. So now that we're here, you can imagine the conversation has shifted from COVID-19, the disease, to the COVID-19 vaccine, whether or not it's safe and effective, whether or not people will participate in it, and for those who want to participate in it, will they be able to access it when they want it, but more importantly, when they need it. And so this is a timely conversation with the right actors, giving Derek's work and my work and your platform. So thank you for having us.
Thank you. I really appreciate both of you guys taking the time. One of the questions that I have for you, as you're mentioning this coalition, this network that's coming together, and we were talking a little bit with Derek before the call started, is about kind of innovation in healthcare, and definitely a trend that I see in our structural or government, to put it plainly, is kind of, lack of innovation and also efficiency and effectiveness. So I'm curious, how is this coalition sharing information and streamlining conversation, making sure that everyone from California to New York, the news coming out from areas in the other part of the globe are centralized, and that conversation is being happened in a transparent way so that everyone can catch up? What tools are you guys using to make sure that you guys all stay connected?
Absolutely. So the COVID-19 Prevention Network, again, is the government entity responsible for evaluating all government-sponsored vaccine candidates. And so what was previously called Operation Warp Speed. And so that includes the Moderna candidate, it includes now the Johnson & Johnson candidate, and other candidates. I'm one of many ambassadors that cover the nation and are tapped into their various networks of engagement. Many of the ambassadors are people like myself who have been trained in scientific research or medicine, but also faith leaders and socialists, social workers, people who have relationships with the most at-risk populations and communities. And tools have been created and empowered us to be able to reach the networks that we already had a good rapport with, human capital with, to be able to share that information through community engagement toolkits, through the vaccine trials, the many vaccine trials that span the vaccine trial sites that span the country. There are over 60. And make sure that early in the pandemic that people had access to testing, right? And now that people have access to vaccines, but we understand what has to preface the access to vaccines is access to vaccine education, because of the skepticism around science, the hesitancy that comes with vaccine, and particularly when you're trying to engage those people who have been disproportionately impacted, like Black and Brown people. You have to deal with the medical mistrust that's inherent in the conversations that we're having about health and healthcare, and the ways in which the healthcare system historically has made people of color more sick. And so persons like myself have been empowered with all the resources of the NIH and the NID, and leveraging our personal relationships, the work that we had done in the past, to be able to engage communities with a level of trust, right? You're a messenger that I trust. And so the message that comes from me, the messenger, has more more impact than perhaps the same message that comes from a messenger that communities don't necessarily trust.
Right. Well, thank you for being an ambassador. I mean, obviously, it sounds like a important effort of the, and I love that name. Sometimes the names that our government comes up with for these types of programs, I'm like, we're living in a movie here. But so I assume they're just kind of disseminating information via like an email service or something like that to you guys. You get all just emails, but there's no type of like in tech, and we use things like, you know, Slack or Google Drive, WhatsApp, things like engagement tools so that we can all collaborate and work together. But it's not a network like that. I was thinking like, oh, great, they've got this whole thing.
There is. And so there's a weekly email that gets sent out, and that email list grows as my engagement grows or as the other ambassadors grow, engagement grows. Obviously, all of the education sessions that we're hosting are virtual, just like this one. And so, you know, I can do 3 or 4 of these in a week that might, you know, engage a faith community in Iowa that wants to know when they can go back into their houses of worship, or it might engage an environmental justice organization in Illinois that wants to know how COVID-19 is impacting the environment and what are the ways in which you know, environmental justice intersects with a global pandemic. And then, you know, the next day it might be with folks in Florida who have the, you know, one of the highest retirement populations in the country, and therefore an at-risk group of people who have been disproportionately affected by COVID-19. And they want to talk about vaccine access to people in long-term care facilities and nursing homes and, you know, these retirement communities. And so it really spans the gambit. And as my engagement grows, the engagement of the network grows, and we begin to reach people in that way. But obviously, you know, we're 6-7 months into the work of the COVID-19 prevention network. And as you can imagine, with the shift in administration on the executive level, also came a shift in the work that we do, and the resources that were available for the work that we do. And we're starting to see that shift impact the larger population in terms of the passing of, you know, COVID-19 relief stimulus packages, and the boom in testing and vaccines that we've had just in the first couple of months of this year. And so we've all learned to be nimble and to be agile and flexible in the ways in which we engage and the ways in which we leverage the resources and the tools that have been made available to us to make sure that everything that I have and everything that I know, the people who want access to that information can get it.
Thank you so much for the work that you're doing. Derek, I'd like to toss it over to you. You're out there, your team is getting people the healthcare that they need. So you're working just as hard as Dr. Burley is. Can you talk a little bit about what that experience has been like for you, for your patients? Have you been getting support from the government? Have you heard from this network, this coalition that's formed?
Kind of, sort of. So we have a physician that we work with that is an advisor to the Biden-Harris Health Equity Team out of Sarasota, Florida. So he's been meeting with us probably on a weekly basis as we were asked, because CoreMed has a reputation of providing a concierge level of service. So we were asked by the Biden-Harris Health Equity Team can we provide the same level of service to at-risk populations? And we answered with a yes. So recently we have come up with a platform for what we call pop-up vaccine tents. And these are really for a lot of our affluent customers, but our at-risk customers get the same level of treatment regardless. So they're really nice high-end tents, concierge experience that these at-risk populations will get once they get their jabs from CoreMed. We are pretty biased on the type of vaccines that we can provide, because we are a delivery logistics company, the Johnson & Johnson vaccine just works better for us. It doesn't have the really deep freezing requirements. It can actually be put in a refrigerator and has 3 months lifespan. From what I understand from talking to one of our pharmacy customers today, I think like Moderna and Pfizer, once you open it, it's only good for 6 hours. Well, we can't do that. Because we have people who were taking it in a cooler to someone's home. We can't have it expiring on us. So we're very excited. We've been waiting for months for the Johnson & Johnson product to get approved, and to finally hear that come out last week, and then on Sunday that it will start shipping this week, is really encouraging for us. So the type of people is a little bit of a pivot for us, because at the beginning, we've always used just general individuals who are making deliveries for us. But now with COVID-19, it requires a healthcare professional. So we're looking at pharmacists, pharmacy techs, there's nurses, LVNs, first responders are actually coming on, becoming CoreMed employees who are actually going out to people's homes so they can give the jab. So it's interesting, but we're really liking the level of talent that's coming into CoreMed and the individuals who are signing up like really quickly, especially in Miami. Miami has been one of the areas that has embraced CoreMed same day, or I say COVID-19 home delivery the most, even more than Dallas, Texas.
That's fantastic to hear. I did forward the information on to our government officials. I don't know if that had anything to do with it, but I was pushing it for it, and I have nothing but well wishes for. I hope to see just explosive growth from you, especially being a person of color, Black man, founder of an innovative company. I really hope that you get everything and all the support that you need to succeed. I want to shift our conversation a little bit to the topic of the day, which is this diverse populations resistance that we are, sometimes seeing, and really the history of medicine and how it has worked healthcare with our people of color, Black populations. So I assume, Dr. Burley, this is partially why you have been brought into this coalition. What is the reason that this coalition in particular regarding people of color was formed? How about we just start there in case people don't know?
Yeah, absolutely. So from working with HIV, so I mentioned that the COVID-19 Prevention Network is the product of a lot of different agencies and entities combined together. One of those entities is the HVTN, which is the HIV Vaccine Trials Network. And they've been for decades working on a viable vaccine for HIV and AIDS. Well, here in the United States, nearly half of the people living with HIV and nearly half of new infections are among Black people in the United States. And so as HIV has been a virus, a disease that has disproportionately impacted people of color, largely because of the social determinants of health. So those structural conditions that make people sick, right? Where people are born, where they work, where they worship, where they access their education and their healthcare. Those things have disproportionately impacted Black people to diseases like HIV. There's nothing inherently pathological about Black skin, about our Blackness, right? They're pathologies within the social milieu of the country that has left people who look like us more vulnerable to things like HIV and AIDS. And so from doing decades of work around HIV and realizing that biomedicine is only as good as the communities who are willing to participate in it, we already knew that COVID-19 was going to be another such case, whereas if a vaccine or if a biomedical solution was going to be the primary way out of COVID-19, then we were going to have to do some very transparent and intentional engagement with Black and Brown communities. Otherwise, a viable vaccine that's 95% protective was just going to be a vaccine in a vial on a shelf, right?
Right.
It's not the novelty of the vaccine. It's actually the novelty of the actual vaccination, right? Once you get it into somebody's arm. But even before HIV and AIDS, as people of color, we've always had to deal with the legacy of medical bias and mistrust. Tuskegee
Yeah.
is probably the most prominent example that people will reference in terms of disenfranchisement against Black people by the government,
Yes.
right?
But there have been other examples as well. Yeah,
Absolutely.
we don't need to get into them.
Yeah, absolutely. And so because of those, there's always been, skepticism and hesitancy about clinical trials, especially as it relates to diseases that disproportionately impact Black people, as COVID-19 has done. And so right away, because of past work and because of the ways in which we could see early on, as early as last April of 2020, that, wow, Black and brown people are 3 times more likely to be hospitalized or put in the ICU and 2 times more likely to die than their white counterparts. Right away, we knew that we were going to have to embark upon an engagement campaign specifically to those communities, just around education and information to allay people's fears and concerns and any myths that have traveled, because now we have to compete with social media, right? And the internet. Everybody has a microphone, and everybody's not necessarily qualified to speak on these technical issues. And so it was important to identify those people who are qualified, but who also have equity in their communities, and to devise a plan in partnership with the communities as to how we can begin to share information so that when the time comes, people
I
can
have a question for you, Dr. Burley. So when you were asked to do this, obviously they want you in to be on the team because of your access to your community that you have spent years building. Did you have any doubts about the vaccine yourself when they asked you? Were you nervous at all? Like, hey, 10 years from now, if we find out this vaccine has, some trouble, here we got Tuskegee again.
Yeah.
Did you have any thoughts cross your mind at any point?
I didn't, and for a few reasons. The first reason was because of the people who invited me into the process. They were people who I trusted, people who I had worked with on the HIV and AIDS pandemic. And so that was first. The second thing is because of my background, before I founded UBtheCURE, I was a clinician and I conducted clinical trials for communities of color around asthma and allergy. And so I was on the other side where I was enrolling patients and seeing patients and following patients, testing novel biomedicines as it relates to people's respiratory health, particularly Latinx and Black populations. And so I understood and understand the infrastructure that's in place now to ensure informed consent, which did not exist with the United States Public Health study of untreated syphilis, or the Tuskegee experiment, right? Informed consent didn't exist then. Okay. And as a result of Tuskegee, we have informed consent now. And so I understood that. But then I also understood the science that was at play in terms of the mRNA technology that gave us the Moderna and the Pfizer vaccines, different technology from the Johnson & Johnson vaccine now that'll be available to us within 48 hours. But I knew that those candidates were probably going to be the first available. And so I made sure I was familiar with the science, and I studied the persons who were involved in it. The primary of which is a Black woman, Dr. Kizzy Corbett, and I trust Black women. And so these were all factors that gave me confidence to say, yes, I'll be a part of this. And yes, I will advocate for this for other people. Now, what I tell people when I speak to them is my mandate isn't to endorse or reject a vaccine. My mandate is to give people the information that they need to be able to reject or endorse a vaccine confidently with informed consent for themselves.
Gotcha.
And so
very responsible.
For me, if you have all the information that you need and you understand and you comprehend the information and you still decide that this vaccine isn't right for you or your family, I can live with that. What I can't live with is you deciding that this vaccine isn't right for you or your family because either you have bad information or misinformation, or you have very little information, not enough information, or you don't have any information at all.
Right.
And so that's what I consider to be an injustice right now. And I'm working to make sure that people have all of the information that I have so that they can make informed decisions for themselves.
Well, thank you so much again for that. Derek, I wanted to ask you, as we're starting to kind of wind down our Q&A, so please, if you're watching out there, you have questions for Dr. Burley and Derek, please make sure you comment those questions in while we have them live here now. CoreMed is, one of the great things about it is a concierge service. It is nice. You don't have to leave your home. Like even before pandemic, when now we can't leave, a lot of us can't leave our homes. But before, it was just a very nice convenience to have.
Right.
And so we know that there's a cost associated to this level of service. And people, Black and brown people, obviously, Black people, we don't have as much wealth as white and other populations here in the United States. So, and then we've got issues as well here in Florida with the vaccine being put in certain places where they, you can't travel to get it and things of that nature. So a CoreMed would be perfect in those situations, but then it goes back to the cost. So is there anything that can be done about that so people can get the CoreMed? Is the government giving out any grants to them to be able to use CoreMed? Can you talk a little bit about that? How are we going to get CoreMed, that concierge service that we all deserve, to everyone?
Yes. So here's something interesting. CoreMed doesn't cost a patient anything. It's free. Now,
really?
Before COVID-19, right? But before we had to bring in professionals to make the deliveries, everybody who received CoreMed was always complimentary. So what we've learned over the years is, and I'm a former healthcare executive, so I'm a business guy, right? So what we learned when we launched the company is that a lot of independent pharmacies were struggling. And the reason they were struggling because they could not outmarket the CVS's and Walgreens. They always had a better service, such as free delivery. Most people don't know that. If you work with an independent pharmacy, they've been delivering to people's homes for like 10 years for free, but they don't market. So what we decided to do is to help them, right? And what we've learned is to keep every delivery free. We have software built into our tool based on your address. When it goes into our system, it identifies the closest independent pharmacy to your home. Anything within 5 miles, our concierge pharmacy partners will deliver to your home for free. So it doesn't matter if you're living on Indian Creek Island, or you're living in Miami Gardens. Regardless, the delivery when utilizing CoreMed is complimentary. Outside of COVID-19, and then I think there's another, I think it's called the antibodies. We were just talking about this over the weekend. Some antibodies for people who already have COVID-19 antibody infusion or something like that. Actually, a nurse has to sit there for you like an hour and infuse you. Outside of that, CoreMed is complimentary to all of our customers, regardless of their ability to pay.
Fantastic. I love that. So is there a way to get the vaccines supplemented by the government to be delivered to people's homes?
We're still working on that. Through the Biden-Harris administration, they did allocate $30 billion for at-risk populations. So we did submit a proposal for CoreMed to be utilized in at-risk neighborhoods like Phoenix, Miami, Chicago, Baltimore, et cetera, et cetera, et cetera. And if we get allocated some of those monies, then we can go and deliver for free. But outside of receiving some of that $30 billion, it'd be pretty tough to pay pharmacists and nurses and stuff to give it away.
Oh, absolutely. I mean, at this point, Johnson & Johnson, they got a lot of money. They should just do it for Black and brown people for free. Talk about, let's see some reparations or recalibrations, whatever you want to call it. That's where I'm at. Okay. Like, you want to make things, that's the biggest marketing campaign right there. There would not be a Black or brown person taking a Moderna in the world when you give it to us for free as patronage or whatever, apology for the systemic racism systems that have been in place that they have benefited from. I don't have data to back it up right now, but I'm sure if I did some research, I could tie it back to wealth in the pockets of the board at Johnson & Johnson very easily. So with that, just a little message out there. If you feel like that is on point, feel free to tag Johnson & Johnson or your local representative. How can people get in touch with you, Derek, and Dr. Burley if they have more questions for you? Dr.
Burley, you go first.
Thank you. Sure. Well, you can visit my website at www.UBtheCURE.com. You can email me at Ulysses Burley, my first and last name, at UBtheCURE.com. And you can follow me on Facebook and Instagram at UBtheCURE, and on Twitter at Ulysses Burley, my first and last name. If you want to learn more about the COVID-19 Prevention Network and vaccine trials, as trials are still happening because we're going to need as many vaccine candidates as possible to meet the need of 7 billion people on Earth, you can visit the COVID-19 Prevention Network's website at www.preventcovid.org, where you can also access their community engagement strategy to learn how the CoVPN is intentionally engaging at-risk communities in the process about their own health.
Great work, great work. And we got that correct there with the UBBE, the cure.
UBtheCURE. So my initials, UBTHECURE.com.
So no BE.
No BE.
Okay, well, we got to correct that because I put up the wrong banner. Put up the wrong URL, everybody. Forget about that one. We want to go with this one. UB.
Yep, that's it.
That's so, I like that because it's like your initials.
Yeah, there's a more profound personal story behind it that we can talk about in another conversation.
Yeah, I would love to hear the story behind that. Thank you. And Derek, what about you? How can people get in touch with you?
Yeah, so the easiest way to kind of follow what we got going on with CoreMed is on LinkedIn. It's just CoreMed, linkedin.com/company/CoreMed. We typically post something new every day that we're doing. One of the things I do want to mention that's also innovative is that we have what we call an Encourage card. An Encourage card allows customers to receive 80% off their prescriptions, similar to, like a GoodRx or Single Care. But when you look at those videos or those commercials, they're always at the pharmacy, right? Because you have to go to the pharmacy to redeem it. Well, we took it another level. You can use the Encourage card. You can save the 80%, but you can stay home and get the concierge delivery. So that's one of the programs that we just launched this month. But to get in contact with me personally, as my email is Derek, DerrickMiles@CoreMed.com.
Derek Miles at CoreMed.com.
Derek.miles@CoreMed.com.
Perfect. There we go. Well, thank you both. This has been quite a wonderful conversation, and I know that we could have talked for longer about this. I appreciate you taking the little bit of time that today to chat, and I hope we can do it again soon. I wish you both a prosperous and blissful year ahead, and everyone out there who is watching as well. Happy March. Let's just keep on going through this, and we'll come out on the other side soon.
See you in Miami.
Sounds good. Yeah.